1. A 3-year-old child presents with high fever, drooling, and difficulty breathing in a tripod position. What is the most likely diagnosis? A. Croup. Epiglottitis? Foreign body aspiration? D. Asthma exacerbation? 2. Which of the following laboratory findings is most consistent with acute kidney injury? A. Decreased creatinine, increased BUN? B. Increased creatinine, increased BUN? C. Normal creatinine, decreased BUN? Decreased creatinine, normal BUN? 3. A 28-year-old pregnant woman at 32 weeks gestation presents with severe headache and visual disturbances. Her blood pressure is 160/110 millimeter Hg. What is the most likely diagnosis? A. Migraine headache. Preeclampsia. C. Essential hypertension. D. Gestational diabetes. 4. A 62-year-old patient with a history of hypertension presents with sudden severe headache, described as worst headache of my life. What is the most appropriate immediate diagnostic test? A. MRI of the brain. B. CT head without contrast. C. Lumbar puncture. D. EEG. A 6-month-old infant presents with fever, irritability, and pulling at the right ear. Otoscopic examination reveals a bulging, erythematous tympanic membrane. What is the most appropriate management? A. Watchful waiting. B. Oral antibiotic amoxicillin. C. Topical antibiotic eardrops only. D. Immediate referral to ENT specialist. 6. In the evaluation of a patient with suspected deep vein thrombosis, DVT, which clinical prediction rule is most commonly used? A. CHADS-2 score. B. Wells score. C. DS2 VAS score. CURB-65 score. 7. In the management of acute bacterial sinusitis, what is the duration of symptoms required before antibiotic therapy is typically indicated? A. 3 days. B's. C. 7 to 10 days. D. 14 days. 8. According to Canadian immunization guidelines, at what age should children receive the first dose of the MMR vaccine? A. 6 months. B. 12 months. C. 18 months. D. 24 months. 9. A 70-year-old patient with chronic obstructive pulmonary disease, COPD, presents with acute exacerbation. Which of the following is not a typical component of management? Bronchodilators. B. Systemic corticosteroids. C. Antibiotics if signs of bacterial infection. D. Long-term oxygen therapy initiation during acute phase. 10. In assessing suicide risk, which of the following factors indicates the highest imminent risk? A. Previous suicide attempt. B. Family history of suicide. C. Specific suicide plan with means available. D. Chronic depression diagnosis. 11. A 35-year-old woman presents with polyuria, polydipsia, and weight loss. Fasting blood glucose is 8.5 millimoles per liters. Which additional test would best confirm the diagnosis of diabetes mellitus? A. Random blood glucose. B. C. Oral glucose tolerance test. D. C. Peptide level. 12. Which of the following screening tests is recommended for colorectal cancer in average-risk adults beginning at age 50? A. Annual digital rectal examination. B. Colonoscopy every 10 years. C. Annual CT colonography. D. Annual CA blood test. 13. A patient on warfarin therapy requires monitoring of which laboratory value? A. B. C. Bleeding time. D. Platelet count. 14. In the management of acute asthma exacerbation, which medication should be administered first? A. Oral corticosteroids. B. Short-acting beta-2 agonist, e.g. salbutamol. Epitropium bromide. Intravenous magnesium sulfate. 15. A 50-year-old man presents with sudden onset of severe unilateral headache, drooping eyelid, and dilated pupil. What is the most likely diagnosis? A. Cluster headache. B. Migraine with aura. C. Posterior communicating artery aneurysm. D. Tension headache. 16. Which of the following is the most common cause of community-acquired pneumonia in adults? A. Mycoplasma pneumoniae. B. Streptococcus pneumoniae. C. Haemophilus influenzae. D. Staphylococcus aureus. 17. A 25-year-old woman presents with a painless thyroid nodule. Which initial test is most appropriate? A. Fine needle aspiration biopsy. Thyroid ultrasound. Thyroid scan. Serum thyroid stimulating hormone TSH. 18. In the treatment of acute bacterial meningitis in adults, which antibiotic combination is recommended as empiric therapy? A. Penicillin G alone. B. Ceftriaxone and vancomycin. C. Ciprofloxacin and metronidazole. D. Amoxicillin and gentamicin. 19. A 60-year-old patient with atrial fibrillation requires anticoagulation. Which score is used to assess stroke risk? A. Wells score. B. Grace score. C. H2VSC score. TIMI score. 20. Which of the following is a contraindication to thrombolytic therapy in acute ischemic stroke? Age over 75 years. B. Blood pressure 185 10 mm Hg. C. Symptom onset 2 hours ago. D. Previous stroke 6 months ago. 21. A newborn presents with jaundice within the first 24 hours of life. What is the most concerning cause? A. Physiologic jaundice. B. Breast milk jaundice. C. Hemolytic disease of the newborn. D. Gilbert syndrome. 22. In the management of acute myocardial infarction with ST elevation STEMI, what is the target time for door-to-balloon percutaneous coronary intervention? A. 30 minutes. B. 60 minutes. C. 90 minutes. D. 120 minutes. 23. A 40-year-old woman presents with fatigue, cold intolerance, and weight gain. TSH is elevated and free T4 is low. What is the most likely diagnosis? A. Primary hypothyroidism. B. Secondary hypothyroidism. C. Subclinical hypothyroidism. D. Thyroid 6 syndrome. 24. Which of the following medications is first-line treatment for generalized anxiety disorder? Benzodiazepines. B. Selective serotonin reuptake inhibitors, SSRIs. C. Tricyclic antidepressants. Beta blockers. 25. A patient with chronic kidney disease should avoid which class of medications due to risk of hyperkalemia? A. Calcium channel blockers. Loop diuretics. ACE inhibitors. Beta blockers. 26. In a patient with suspected pulmonary embolism and hemodynamic instability, what is the most appropriate immediate management? A. Obtain CT pulmonary angiography. B. Start therapeutic anticoagulation. C. Administer thrombolytic therapy. D. Perform ventilation perfusion scan. 27. Which of the following is the most common cause of hypercalcemia in hospitalized patients? Primary hyperparathyroidism. C. C. Vitamin D toxicity. Diuretics. 28. A 30-year-old man presents with lower back pain that improves with exercise and worsens with rest. He has morning stiffness lasting over 1 hour. What is the most likely diagnosis? A. Mechanical low back pain. B. Lumbar disc herniation. Ankylosing spondylitis. Spinal stenosis. 29. According to the Canadian Cervical Cancer Screening Guidelines, at what age should routine Pap screening begin? A. 18 years. B. 21 years. C. 25 years. 30 years. 30. A patient presents with acute onset of severe epigastric pain radiating to the back, nausea, and vomiting. Serum lipase is markedly elevated. What is the most common cause of this condition in Canada? Alcohol abuse. Hypertriglyceridemia. Medications. 31. In the evaluation of anemia, which laboratory finding is consistent with iron deficiency anemia? A high MCV, high ferritin. B, low ferritin. C, high ferritin. D, high MCV. 32. A 65-year-old patient with heart failure should be prescribed which medication class that has been shown to reduce mortality? A, BACE inhibitors. Diuretics. D, calcium channel blockers. 33. Which of the following is the recommended first-line imaging modality for suspected acute appendicitis in adults? A, plain abdominal X-ray. Ultrasound. CT scan of abdomen and pelvis. D, MRI 34. A patient with rheumatoid arthritis requires disease-modifying anti-rheumatic drug, DMARD therapy. Which medication is typically used as first-line DMARD? A, hydroxychloroquine. Methotrexate. C, dilaflunomide. 35. In a patient with suspected bacterial endocarditis, which diagnostic criterion requires the presence of positive blood cultures? A, Jones criteria. Do criteria. Criteria. Ranson criteria. 36. A 22-year-old woman presents with pelvic pain, vaginal discharge, and fever. Cervical motion tenderness is present on examination. What is the most likely diagnosis? A, ectopic pregnancy. Ovarian cyst. C, pelvic inflammatory disease. Appendicitis. 37. Which of the following medications should be discontinued before elective surgery due to increased bleeding risk? Metformin. B, lisinopril. Diauroxine. 38. A patient with known HIV infection should begin prophylaxis for pneumocystis jirovecii pneumonia, PCP, when the CD4 count falls below which threshold? A, 500 cells. B, 350 cells. C, 200 cells. D, 100 cells. Murmur.